Now, tax experts say Finance Minister Enoch Godongwana is unlikely to make major tax changes in today's 2022 budget speech. Godongwana will be delivering his budget at a time when the country's economy is struggling with record high levels of unemployment. The Healthy Living Alliance organization, also known as HEALA, wants Godongwana to immediately increase the Health Promotion Levy tax rate from 11% to 20% and to commit to annual adjustments of this tax rate that account for inflation. HEALA is a coalition of civil society organizations that advocates for equitable access to affordable and nutritious food for all South Africans. To talk to us more about this, we're joined via Zoom by Healthy Living Alliance Project Manager Nzama Mbalati. A very good day to you, Mr. Mbalati. Thanks for making the time.
Good day, Desiree, and all the viewers.
Remind us about, I just touched a bit on it, the mission of the Healthy Living Alliance as an organization. What does it do?
So I think if we're coming from the post-crisis situation with COVID-19, and we know the excess death was at 300,000 people, and we know more than half of those people had underlying conditions like diabetes, hypertension, obesity. And we know sugar, excessive consumption of sugar, is a key driver in terms of for those conditions. So our submission has been to Minister of Finance that we expect him to increase the health promotion levy. From the onset, we shouldn't be negotiating health taxes increase such as tobacco and alcohol and the health promotion levy, because these taxes are meant to protect the health of the population. So we are sitting in a situation where we've been banging the door and shouting the loudest, but we believe that we shouldn't be asking the minister to increase health taxes, because its aim and the key objective is to protect the population of citizens.
So what are your expectations about the budget speech today?
So what we expect is that because there is a dire need to cater, to have a budget that cater for socio-economic rights. So having access to quality education, having access to quality health care, there's a need for increasing and bringing provision and increasing the safety net on the social protection. So we expect him to talk about increasing health taxes in general and overall, including tobacco, alcohol, and the health promotion levy. That's what we're expecting from him. And I think we shouldn't be asking this from the minister, because these taxes are not just penalizing taxes. They are taxes that are actually wanting to ensure that every South African can have protection. Their health could be protected through measures and legislation that the state must take within its and take reasonable steps within its means.
What should the finance minister prioritize when he delivers this budget?
I think he has to prioritize ensuring that he addresses hunger, poverty, and inequality. So if you look at the situation that we are in, more and more South Africans are going to bed hungry. More and more South Africans have become poorer. So I think it's important that, amongst other measures, that the state in its social wage can ensure that it caters to address hunger, poverty, and inequality. And we think the health promotion levy, it's an instrument within his toolbox to ensure that the much needed revenue can be raised, and other health taxes, because these taxes, its main aim and the mandate is to protect the health of the population. So we believe that he can balance that, he can ensure that it is protecting the population's health, and he can get much more needed revenue to provide for socio-economic rights and ensuring that we address poverty, hunger, and inequality.
So HEALA is calling for an immediate increase of the health promotion levy tax rate from 11% to 20%. It's quite a big number.
It is a big number, and I think it's quite unfair because since 2018, we're almost going into the 5-year anniversary this year without seeing any significant movement, because I think this call is not just a whooping amount. It's an international benchmark. It's a recommendation by the World Health Organization. If you look at Treasury, public consultation figure when it came in and wanted to propose this tax, it was also at 20%. So we took a lot of back and forth, and we've lost some grounds already by not implementing the tax at its required threshold of the 20%.
Yeah. Well, let's thank you for talking to us, and we hope that the minister is listening and he will provide for your lobby questions. Mr. Mbalati.
Thank you so much.
Healthy Living Alliance Project Manager, Lawrence Nzama Mbalati.